And anyone claiming CME credits, complete the sign-in process through the cloud CME, and that slide, should be coming up, and there it is. And you can text that to 31802, and that will be on your screen as well. For the can use the single sign-on option. Again, if you're claiming CME, that's an easy way to do it. I see everybody has muted their microphone. Appreciate that. And an easy way to get us started is you can turn your video off, and then you can pin our guest presenter, that is Erin Barrus. So all you have to do is right-click on the presenter's name and select pin, and magically Erin will appear. We'll take questions at the end, but I'll be monitoring the chat, and I will introduce Erin. So she is, we're thrilled that she's presenting to us today. She has a passion about this topic. She works with us as a clinical rehab specialist and an occupational therapist. She is a Bronco, a graduate of Western Michigan University with a Master's of Science in Occupational Therapy. She also holds a Bachelor of Fine Arts in Interior Design from Kendall College of Art and Design, and has a special interest in aging in place. In her role here at Spectrum Health, Erin designs and implements evidence-based clinical pathways with the support of our medical providers to aid the patients and families in receiving the best rehab care and to address any physical, cognitive, psychosocial concerns related to cancer treatments. We're thrilled that she's agreed to chat with us today, and I will turn it over to Erin. Welcome.
Can everybody hear me okay?
Yes, we can.
Okay, great, thank you. I'm just waiting for the presentation to pop up. Catherine, can you jump to the next slide? Thanks. So thank you all for joining in on this brief overview of cancer rehabilitation. I'm Erin Barrus, the Oncology Clinical Rehabilitation Specialist for Rehabilitation Services here at Spectrum Health. Next slide. So today we will cover what cancer rehabilitation is and who makes up our team, common symptoms, and a brief overview of symptom management, and finally discuss our options for services both virtually and in person. So who exactly are we and what do we do? We are a group of specially trained physical therapists, occupational therapists, and speech and language pathologists. We have gone through training in the etiology of cancer, the various medical treatment interventions, the side effects of those treatments, and corresponding management specific to our disciplines. We focus on function and maximizing quality of life for each of our patients. We ideally get involved in the early stages of the diagnosis so we can tackle the side effects in a proactive way because we know what's coming. We continue to address functional changes throughout treatment and after treatment. Some of these pesky side effects may show up even after cancer treatment is complete. We are not limited by prognosis, as we can provide education and recommendations to any patient at all stages of life. The patients and their caregivers' goals and ability to achieve them are what drives us to be our absolute best. While each discipline focuses on function, safety, and quality of life, we all serve a different purpose within the patient's plan of care. Next slide. So physical therapists are the experts in movement and body mechanics. PTs assist in balance, strengthening, and stretching to avoid injury. They develop a plan with their patients to reduce pain, improve musculoskeletal movement, and restore function. They can specialize in all areas of the body, not only shoulders, hips, and knees, and the other areas we commonly think of, but also the pelvic floor. Next slide. Occupational therapists are the experts in maximizing functional performance, both physically and psychologically, in everyday living skills. OTs will assist in environmental modification, including equipment recommendations and home safety evaluations. They will teach patients strategies to participate in the activities that they want and need to complete in the most efficient way possible. OTs identify barriers that keep patients from doing these tasks and then help break those barriers down. Speech and language pathologists are the experts in swallowing, voice restoration, and cognitive rehabilitation. SLPs provide education and treatment on how voice and swallowing may be impacted by various interventions. They can provide appropriate recommendations for safe eating, as well as strengthening exercises to assist in vocalization and swallowing. If word finding or memory becomes an issue, SLPs will teach patients and families about strategies to improve thinking. Up next is symptom management. As I dig into some of the specifics, I will take on a perspective of talking to the patients and family members on the line. So for all the physicians, advanced practice providers, and other medical professionals, you may hear of these common complaints from your patients. I'm hopeful that you will be able to quickly identify when therapy would be a great option for your patients to help gain a greater control over their own lives. Some of the most common side effects of cancer treatment include fatigue, decreased stamina, cognitive changes, neuropathy of the hands or feet, decreased balance, and decreased strength. This can lead to patients discontinuing important roles and routines. Patients may feel like they must let go of the activities that they enjoy because they're just too tired, or that they're expected to stop these important activities because of treatment or treatment side effects. This can lead to decreased quality of life and have a further impact on the patient's overall physical and emotional well-being. We strive to help find the balance in achieving goals for safe and enjoyable participation in every aspect of daily life. Cancer-related fatigue is one of the most common and underreported side effects of cancer treatment. It is often described as a constant sense of tiredness that interferes with daily life and overall quality of life. Ironically, one of the most proven ways to combat this fatigue is physical activity and exercise. This can be as simple as getting into the habit of walking daily and gentle strengthening. The evidence shows us that a combination of moderate-paced aerobic exercise and strengthening exercise not only improves fatigue, but also aids in maximizing medical treatment effects. To ensure that fatigue doesn't stop you from doing what is most important to you, your PT and/or OT will recommend tools to help reduce fatigue and allow you to save your energy for what really matters to you. If cancer-related fatigue is affecting you now, I strongly recommend journaling the activities that fatigue you physically, mentally, and emotionally. This will help pinpoint the areas of daily life that need to be addressed and who can best support you. We all wake up every day with a certain amount of energy. Sometimes it's higher than others, and sometimes it's certainly lower. Every task that is completed during the day takes a little, and sometimes a lot, from our personal bank of energy. As cancer rehab therapists, we teach you the tools on how to reduce how much energy will be depleted. Think of it as a 25 to 50% off sale so that you can keep some of the energy to spend on something else later. Chemotherapy-induced peripheral neuropathy, or CIPN, is often described as pain, tingling, numbness, or sensitivity in the hands and/or feet. This can lead to decreased balance, increased weakness, or feeling like you're lost in space or don't know where your feet are landing. Sometimes patients will experience foot drop or the inability to lift their toes up off the ground. This can look like the toes are dragging on the ground as normal heel-to-toe walking patterns become difficult. All of these issues put you at higher risk for falls and injury. Rehab can aid in providing pain management techniques, exercises to strengthen muscle groups that are not getting a strong enough neurological signal, which contributes to the overall weakness, provide you with education on safety for home management tasks due to sensory impairments, and home modification recommendations to reduce risk of falls. Cancer-related cognitive impairment, also commonly known as chemo brain, is another common side effect that can impact a person's overall quality of life. A person may experience thinking and/or memory problems due to cancer and cancer treatment. Rehabilitation services will provide education on proper tools to stay organized and to stay safe. As previously stated, exercise has a positive impact on how the body functions and is proven to increase memory centers within the brain to improve overall cognition. Therapists also provide mental strengthening exercises and compensatory strategies for word finding and attention. Each person will experience cancer-related side effects differently. Some patients may only have one side effect, while others may present with several side effects. We are here to help navigate these challenges our patients are facing that directly impact their participation in daily life. Next up is patient access for rehabilitation services, both virtually and in person. In the wake of COVID-19, rehabilitation services as a whole has been working diligently on our virtual presence to allow patients another avenue to receive the services that they need in a way that they are the most comfortable. We are now providing virtual therapy through MyChart. We have a team of Spectrum Health therapists who have gone through special technology training to assist patients in this new avenue of care. This group of therapists is also quickly growing. OT, PT, and speech services are all available virtually and in person to our patients. In our clinics, we are practicing social distancing guidelines and limiting the number of people within our spaces. We continue to practice proper sanitization processes. We encourage anyone who needs therapy services, but may be feeling a little bit nervous about going into a public clinic or don't feel that they can tolerate wearing a mask during their therapy session, to try our virtual option. As I mentioned earlier, proactive therapy is critical. If you need us, please utilize one of these options for evaluation and treatment. It will save you money, time, and allow you to get back to normal living more quickly. Patients have the option to be seen for initial evaluations either in person or virtually. We are no longer requiring an initial in-person visit to start a plan of care. Along with the patient, the therapist will determine the best plan for follow-up. That could include treatment in person, virtually, or a combination of both. We are hopeful that our virtual visit option will decrease appointment burden or burnout for our patients while also addressing their goals within their own homes. Additionally, Spectrum Health Rehabilitation Services has partnered with MedBridge, a virtual platform that can be used on a smartphone, tablet, or computer. This platform or application allows exercise programs and education to be sent electronically to a patient or their family member. MedBridge is completely free for patients and allows for individualized exercise programs to be created and modified at all levels of care within our delivery system. So this means if a patient was seen by a Spectrum Health home care therapist and transitioned to outpatient, the next therapist can see exactly what the patient was assigned and advance the exercise program as needed. This has drastically improved communication between patients and therapists in all of our settings. If a patient is not tech savvy or does not want to utilize the application, the therapist can still create an individualized exercise program and provide a hard copy print-off. The patient will be saved to our database to allow for future therapists to modify the program as needed. There are many unique features to MedBridge, including the ability to track exercises when completed and if they were too easy or too hard, the ability to communicate with either your therapist or the virtual therapy team, and the ability for your therapist to complete modifications in real time to avoid an extra visit. To gain more information about cancer rehabilitation, I invite everyone to attend our free virtual series called Living Well During Cancer Treatment. Cancer Rehabilitation has partnered with nutrition services and social work to provide introductory education on the common side effects and stressors that patients and families can experience after receiving a cancer diagnosis. The class focuses on taking control of symptoms, empowering patients to own their own plan of care, and learn about various supportive services that are available across the Spectrum Health system. The series consists of 4 one-hour sessions offered at the beginning of every quarter. The first week focuses on your personal action plan. We will assist patients and family members in setting goals and giving a brief overview of available services. We go over the introduction of side effects and specific tips on how to manage them. So an extension of this presentation. The second week focuses more on exercise and the benefits to your overall health and well-being. A sample exercise program will be provided. The third week focuses on nutrition, where patients will learn to make good food choices and strategies on how to manage side effects. The fourth week focuses on social work, which will guide patients through the complexities of insurance forms, financial support, emotional support, and advanced directives. Our next series is actually in just a few weeks and kicks off on the first Tuesday of the month, which is October 6th from 11 a.m. to 12 p.m. To register or for more information, please feel free to email cancer.rehab@spectrumhealth.org or feel free to call 616-486-7827. Lastly, I wanted to share our comprehensive list of cancer rehabilitation clinics in the greater Grand Rapids area and regional locations. As you can see, we have a rather large footprint and we are here to serve our communities. I thank you all for your time and engagement in this presentation. I will gladly take any questions and comments at this time. Mary Kay, I think you're on mute.
Whoops, I'm chatting away. Sorry. And,
oh, you're fine.
Chatting away and didn't realize I had muted myself. Erin, thank you for that presentation. That was great. I appreciate your insights there. I will monitor the chat, and you could either type something in the chat or raise your hand. And in the meantime, while we're waiting for questions or see what kind of questions there are out there, Erin, I wonder if I could ask you something. I thought that was a cute way to say it. Think about conserving energy as a 25 to 50% off sale, which resonates with so many of us. But if you think about, conserving energy, that, as providers or, practitioners, we kind of go through our day, and sometimes that isn't always top of mind, or that there's perhaps strategies that we could use that we don't often think of. I was struck when during this COVID pandemic, the team decided to try to accommodate patients and do some of the port flushes in a parking spot in the Lemon Holton Cancer Pavilion parking structure. And one of the unintended consequences that we didn't realize until later was when people commented that it just saves so much energy for them and they don't experience as much fatigue. And we also found out that we had less falls. So are there other things that you run across in your practice that, or there's a story that might be illustrative for us about conserving energy for patients?
Absolutely. So when I'm working with patients who are struggling with fatigue in particular, I'll jump right into the 4 P's of energy conservation, which are planning, prioritizing. Now that the question's been pinpointed, I'm probably going to forget all of them. But planning, prioritizing, positioning. Oh shoot, go figure, huh? we focus on those aspects so that people are trying to think ahead in daily activities. So when I suggested journaling and figuring out what exactly is causing people to be the most fatigued during the day, that kind of helps pinpoint exactly what we can do in order to make appropriate suggestions. So I work primarily at Butterworth as an occupational therapist when I'm not doing my clinical rehabilitation specialist role. So I do a lot of education on self-care, so more of the bathing, dressing, toileting aspect. And we might talk about different types of equipment that can be utilized to make those self-cares way easier and not take away so much, so that if somebody has a dinner event with their family later on in the day, they're not expending all of their energy trying to take a hot standing shower where they're having major fluctuations in temperature. And then that way they can rest afterwards and then have more energy that they might not have had later on in the day. So.
Yeah, I thought that was intriguing of you, how you started this with, it might seem counterintuitive to start an exercise program to learn how to conserve energy. And I thought that was just it's a interesting way to look at things.
Yes, and Nikki Coy just commented on the fourth P, which is prioritizing. Thank you, Nikki.
And I see a question here from Laurel. Could you talk about prehab and how to access and the importance of it? Yesterday, it was a topic with the surgical discussion.
Yes, absolutely. So prehabilitation has been getting a lot of press lately in the evidence-based literature across all areas of practice. So prehabilitation is extremely important, especially if we've got a little bit of time before, say, a surgical intervention or even during neoadjuvant chemotherapy treatments. So with cancer treatment, there's a lot going on, which that's evident for anybody that's been diagnosed and has jumped right in head first in everything that's going on. Where prehab plays a role is we focus on more of the functional components of everything. So we're looking at how can we jumpstart some initial education on those 4 Ps, on the energy conservation. And depending on what the diagnosis is, we can start strengthening specific muscle groups preoperatively or improving overall endurance, especially if people are feeling short of breath or have specific comorbidities that may impact their healing process during and after intervention. So there's a lot of benefit to prehab, without a doubt, for the benefit of the patient and their family members.
Excellent. Good. Thank you. Andrea asked, could you tell us about how to approach patients when with consulting with your team? Many people think PTOT is just related to ortho rather than oncology. What have you found that are some good approaches?
Can you clarify the question a little bit more, Andrea? I want to make sure I understand it clearly.
Yeah,
I'm curious about how to have that conversation with the patients.
Oh, sure.
As some of them, when they think of PTOT, are just, might think, oh, I don't need to do that. I have breast cancer and I don't have anything, wrong with my knees or whatever. People kind of think they associate PTOT with something else. And so I'm wondering how you can share with the folks who are on the line, maybe talking points about why PTOT is not just related to ortho and how it can really help patients who don't have any orthopedic problems.
Sure. So great question. And thank you for clarifying that. It helps kind of drive where I want to go with that. So, and you're absolutely right. When people think of therapy, they automatically go into orthopedics. And that's because it's been a huge driver of referrals for forever and ever and ever. And as in the last probably 2 or 3 decades, there have been some great leaders who have done a lot of research in cancer rehabilitation. And we know with various chemotherapies and radiation oncology, And then obviously the post-surgical concerns, there are a lot of functional deficits that go into all of these things. So chemotherapy can have side effects like chemo-induced peripheral neuropathy. And you can get that from chemotherapy while undergoing breast cancer treatment. So while everybody thinks to focus on the arms and the upper body and postural support, later down in the treatment intervention line, if they are on a certain type of chemotherapy that has a side effect of CIPN, they may experience profound lower extremity weakness. And nobody really thinks about that with breast cancer because you're thinking upper body. So it's important to look at the whole picture of what the treatment plan is going to look like.
Great, thank you. There's another question here from, where was it? From Laurel. It was good. Hey, anything new with lymphedema and lymphedema screening?
Yes. So thank you, Laurel, for bringing that up. The one common side effect that I did not talk about in my presentation is lymphedema, and that is the swelling of a limb or limbs in which you've had a lymph node dissection surgically, or it can also be complicated by radiation. So we have the lymphedema clinic available at Lemon Holton Cancer Pavilion. And we have a few outpatient clinics in the regional settings where there are lymphedema therapists as well. All therapists have gotten specialty trained, and there is a new lymphedema prevention program that is in the works, and we're hoping to get that up and going here very shortly. The lymphedema clinic in Grand Rapids is absolutely phenomenal, and their therapists are a wealth of knowledge. So that's very exciting to get that up and rolling. And then Zealand will hopefully be following that very shortly.
Okay, excellent. Another question here, as COVID-19 continues to impact us, we're trying to do as much from home as we can, right? Mm-hmm. And do you have any recommendations for basic equipment or supplies that patients could use at home that will help with the healing? And secondly, do you know if the rehab related equipment is covered by an HSA?
Okay, yes. So some equipment that if anybody is going to Lemon Holton, Airway Oxygen now has a space within the third floor, which I have shockingly utilized probably more than anybody else. I've gotten to really know those guys in there in terms of equipment recommendations for patients I'm seeing at Lemon Holton as well. So a few things that are very helpful would be grab bars in the bathroom, four-wheeled walkers. I know a lot of people say, I don't want a walker. It makes me feel old, but I try to educate people that really you're just trying to use a tool in your toolbox. You don't want to try to hammer in a nail with a screwdriver. If you have the right tools, you'll be more successful. And with a four-wheeled walker, you constantly have a seat with you. So if you're out in the middle of the park getting in your exercise or you're walking for the day, if a bench is not right there when you start to feel tired, you can just lock your brakes and sit down. So other things that are very helpful could be a shower chair or a tub transfer bench for sitting down in the shower. A handheld shower head is also very helpful. Just a few common recommendations.
Yeah, that's good.
Yeah. So as far as if equipment is covered by HSA, there are some pieces of equipment that are covered by insurance. And so you have to reach out to your specific insurance provider to see what will be covered. In terms of what you are allowed to spend with your HSA account, I believe most of that equipment does qualify, but I would double check with your insurance companies.
Mm-hmm. Okay. Just on that same vein, before I get to the next question, it just seems like everybody could benefit from having a, PTOT kind of referral. Are there populations that typically, kind of breeze through cancer treatment and really don't need cancer treatment from our perspective, right? From the Lemon Holton Center,
Sure.
For the cancer health. is there populations you find out that don't really need your service? Because it just seems like everybody would.
That's a great question. And quite honestly, I don't think that it would hurt anybody with a cancer diagnosis to at least have an evaluation and a follow-up treatment to make sure that they understand some of the side effects that can occur from surgery, chemotherapy, or the 5 pillars of treatment, immunotherapies, and radiation oncology. So even if there's only a few visits, the education is there. They can be taught what to look out for. We have lots of education to provide to patients. And then to help get them set up with a proper exercise program. So there's the blood cancers like multiple myeloma. We have to be cautious with that patient population, especially if they have lesions in bones, which could cause potential fractures. And we need to be very smart and wise about that. Cancer rehabilitation therapists have the background and the education on that to provide proper recommendations. So it certainly doesn't help to go ahead and ask for an evaluation and treatment plan of care, and whether they get seen for 1, 2, 3 visits or longer, it will just depend on what that particular person needs.
Mm-hmm. Seems like it'd be better that docs would have to opt out of your services than opt in.
I agree with that.
Yeah. Another question here's one from Nikki. Can you speak briefly to the evidence-based literature related to importance of exercise for patients before and during treatment? And specifically, what type of exercises most benefit the patients?
Sure.
So, for example, like what could our frontline clinicians suggest for patients in terms of an exercise program while providing chemo education even?
Sure, absolutely. So moderate paced activity has been proven to be the best. So a lot of people may think high intensity interval training. And unless you've been an active person prior to diagnosis, that would be likely too intense for anybody who wasn't already either running or biking regularly. So encouraging walking is huge. We have to keep in mind comorbidities such as COPD, especially if somebody has lung cancer. They're not going to be able to get out there and walk 30 minutes at a time, at least at a moderate pace. We can go into education with them on what's appropriate. In terms of strengthening, that's something that I don't believe probably any of us get enough of. And going through exactly how much weight to lift and how many repetitions is that's been shown in the literature to be the most beneficial. So you can do a one rep max and then figure out, do you do 8 to 15 repetitions of that depending on your side effects, and then how often per week to do so. So there's great literature out there that really provides a great guideline on how to be active and what to do. And by getting involved in therapy, we can go ahead and provide that education to patients so that they can own their own exercise program at home or out in the community.
Yeah, and I don't think we give enough visibility to the whole just get started and do something for 5 minutes kind of thing. And it's a stair step that,
right.
5 minutes one day is 7 the next. And pretty soon, you're working out for, half hour, 45 minutes, or you're walking in it. I think so many folks think you got to be able to try to jump in and run for an hour kind of thing.
Yep. And that's why that Couch to 5K app was so huge for people just in the general public, because you can't just get out there and run 10 miles. You've got to slowly build up your endurance and tolerance for that level of activity.
Yeah, excellent. And Andrew is asking, do you have any success stories you'd be willing to share with us? I agree. It would be fun to hear some of the things that were, you didn't anticipate, and it really turned out to be a big success story for a patient.
Oh gosh. I know that there are so many and several. I don't know if there's anybody from Rehab on the line that would have a specific patient story. But I've worked with many patients in the past who have undergone all different types of surgical interventions. Also the blood and marrow transplant team. I think some great stories are also, they come with some sadness in some regards because there's a loss of something. We can be honest about that. Dr. Steensma is an ortho-oncologist and saw a patient of his where they had a total, or was it a hemipelvectomy, and lost their entire leg. And working with that person was pretty remarkable. And he went through rehabilitation and eventually got to the point where he learned how to golf again, which is pretty remarkable. And it's been great to stay in touch with patients as they go through their journey too, and just to see them get back to what matters to them and the goals that they have.
Oh, yeah, hooray. That's a great story, you
Yeah.
know, being able to get back to golf again and the things that you enjoy.
Yeah.
Well, hopefully you have a good golf game and enjoy it. Excellent. You know, the other thing, Erin, is while we got you on the line, we got just another few minutes, is that so oftentimes, well, not so oftentimes, most of the time we're focused on the patient, but what about staff? I'd be curious your thoughts about this of, you know, how do you, are there suggestions for us for staff, you know, especially with some of the grueling hours that we work, that you made observations or could make recommendations for us about, one, either conserving energy or tricks along the way that would help us, you know, stay in shape and things like that. I mean, you know, many of folks know that I walk a lot and I end up walking through the stairwells, not just randomly, but, you know, I use the steps instead of using the elevator. And it's things like that that really made me conscious about how much, you know, you can get exercise throughout your day. You got to be intentional about it, which is really challenging to do, especially when you feel like you're dead tired.
Right.
Do you have any thoughts or ideas for us?
Sure. So I think you've named several great ideas. Taking the stairs whenever you're at work is great. And if you're working inside Lemon Holton, every floor is 2 flights of stairs, 2 full flights of stairs. If you're working in any of the hospital systems, by all means, the stairs are great for overall health and well-being. Working on major muscle groups that don't get nearly the workout that they need, quite frankly. Especially with COVID-19 locking down the gyms up until just last week here in Michigan, at least, walking has been, I think, has been a huge thing, and for people to continue walking. And fortunately, at least within the medical center, having closer parking has allowed people to walk a lot more than they probably have realized. I mean, my steps have increased dramatically with my new parking situation, so that's been wonderful. Other things to consider, especially while the weather is still nice, getting out on your bicycle if you have one, or even rollerblades, or anything to be outside and to be active. And then also doing some type of strengthening, because as I mentioned, none of us probably get enough strengthening in our day. With the new insurance policy sign up right now, Healthy Lifestyles offers a lot of great programs, and I would highly recommend that everyone utilizes that program.
Mm-hmm. And, you know, for those of us in meetings as well, you can find these some exercise programs, at least I have on Pinterest or things like that. And, you know, hate to admit this in front of 30 something other people, but sometimes when you're in a meeting, but your camera isn't on, it's like you can do some push-ups,
Yeah, you sure can.
You know, while you're listening, or squats or things like that.
Yeah,
So,
or even just standing rather than sitting.
Yeah.
Even something as simple as that.
Yeah. So here's Nikki saying, I like doing wall holds during meetings with my video camera off. Yeah. And we thank you for that, Nikki.
One of my favorite stories you shared was, I think you were doing push-ups or air squats and someone called on you during a meeting and you had to scramble to get back. I love it.
Telling all my oops. Yeah, you got to be so intentional about it. Oh. Any other questions that folks want to put in the chat or raise your hand? Happy to have more. And I think it's important to concentrate on the caregivers too. So that's, Erin, why I'm glad we spent a little time talking about what we can do to try to stay in shape while we're at work and stuff, because so oftentimes we are so focused on the patient, but got to be able to make sure that we refuel for our caregivers as well.
Absolutely. And that's a very, very excellent point, especially depending on where people are in their treatment plan. Making sure you're taking time out of your day to care for your overall mental health and well-being as a caregiver is so important, because if you're not taking care of yourself, you can't care for others.
Yeah. So before we close, Erin, can I just ask you one last question? I'm just really curious in reading your background. So it might have seemed like a right-hand turn to start out at Kendall in the fine arts.
Yeah.
And your parents might have thought that too. But what happened there that you were going down the path of a bachelor's in fine arts and then took a turn and went into the OT space? What happened?
Well, so before I graduated with my degree, my BFA in interior design, but before that I had been in a kinesiology program and decided at that point I enjoyed the exercise sciences, but I wanted to do something that I thought would be more creative. So I jumped over to interior design and I absolutely loved it. Got involved in that aspect of work for quite a few years, and then realized I really missed the exercise science and the functional portion of everybody's daily life. And I was learning about it in interior design, about how to make a space functional for a person. And I quickly realized that you can only be successful in a space if you understand what a person needs to accomplish. And I started reflecting back on some past experiences that I had had during shadowing as a high school student. So that had been many years ago, and decided that I wanted to go back to occupational therapy and get my master's degree in that, so that I could really take the education I had in interior design and apply it to people in a greater sense. So it's interesting. Everybody, whenever I talk to patients about this, they always tell me, oh, it seems like the two worlds don't connect, but they really shockingly are very interlinked.
I knew there was a story there.
Yeah.
But yeah, that's funny that you find the connection.
Yeah.
And yeah, you think you're maybe you went here and then decided all of a sudden quickly not, but your thinking along the way and your insight is really kind of fascinating just to listen to your stories. So
yeah,
that's great.
It's great from a perspective standpoint.
Yeah.
Yeah.
Well, I want to thank, I see no more questions in the chat. Just a reminder that Headspace app is great. And Dr. Kristi Artz will be up next, and she could talk a little bit about the Headspace app as well, because their group was instrumental in getting that for our teams. But before we do that, we're going to go into an intermission. So Erin, thank you so much for joining us. We really appreciate your time and learned a lot there from your talk.
Well, thank you so much for having me. I really appreciate it.
All right, excellent. Well, we're going to go into an intermission right now. We're going to take probably a 12-minute break. And so it's an opportunity to go stretch your legs, go to the restroom, get a glass of water. And like I said, you'll want to be back here at 1 o'clock, and we'll open that back up to Dr. Kristi Artz on lifestyle medicine. She's an interesting woman, and she's she's a bit of a pioneer in forging new territory for us for Spectrum Health. So be sure to tune back in, and we will chat again at 1 p.m. Thank you. We are back. It is 1:00. Catherine, are you going to advance the slide?
There you go. Yeah.
Okay, excellent. Thank you. So hopefully you're all back from break. And just going to repeat a few little housekeeping rules here. That again, our session is being recorded. And if you're claiming CME credit, please complete the sign-in process and send it to the mobile app. Or you can text the 31802, and she'll put that up on the screen in just a second. Or you can use the single sign-on option. Again, if you all would be so kind as to mute your microphone, and then you turn your video off, and then you pin our presenter. So that is Dr. Kristi Artz. And to do this, you right-click on the presenter's name and then select the pin option. And again, she'll magically appear. So I'm going to introduce Dr. Kristi Artz. I had the good fortune of getting to know her through this healthy lifestyle or lifestyle medicine. And I'm sure she'll give you a little bit of background on that. But fascinating gal, and you're going to really enjoy her talk. So she focuses on living a healthy lifestyle, which she practices what she preaches, for not only herself and her family, but also encourages it for her patients. Motivated by treating patients with acute and chronic illness, Dr. Kristi's Artz is focused on reimagining how we connect with patients using personalized lifestyle interventions, including food as medicine. She's a board-certified emergency medicine physician, and she has her diploma in the American Board of Lifestyle Medicine. Who knew there really was a lifestyle medicine whole entity with the 6 components, and she's one of the early folks in the country getting boarded in this area of expertise. And surprised that we have this here in Grand Rapids at Spectrum Health, and really leading the country in a lot of different things that we're offering. And there's always new developments every day. She serves as the medical director of lifestyle medicine and virtual health, as well as our lead physician in the culinary medicine program here at Spectrum Health in Grand Rapids, Michigan. Today, she's going to be talking with us about and giving us some really interesting information about culinary medicine and how it relates to survivorship. So I just want to personally thank Dr. Artz for joining us, and I'm going to turn it over to you. And I know we'll have questions, so I promise that I will monitor the chat as well. So Dr. Artz, turn it over to you.
Thank you, Mary Kay, for that kind introduction. And it's great to be with all of you virtually today for the short period of time where I'm excited. We're going to really dig into the concept of using food as medicine and really the power of plants. That's what I've titled this talk today. I think there was definitely a method to having this talk after listening to Erin's talk on physical activity and just how we learn to stack these habits consistently so that we can improve our health, we can potentially prevent disease, and sometimes we can better manage or even reverse disease through many of our lifestyle habits, with food and daily movement being 2 of the biggest ones. So as Mary Kay mentioned, I am an emergency medicine doctor by training, but over the last 10 years or so really have spent time re-educating myself around all the areas of medicine that we spend less time on learning about when we're medical students and residents and early on in our careers. And there's just so much power to be had in these daily habits that we can build upon, that we can introduce at any time in our lives, at any stage of illness or health, and we can always potentially see improvement. So I'm going to focus on, like I said, the power of plants, and just give me a moment. I'm going to go ahead and share my screen to pull up the slides. Okay, Catherine, can you just give me an okay that you're seeing my slides?
Yep, you are all set on my end. Looks great.
Okay, excellent, great. So with that, I'm going to focus on these items as we move through this talk today, and I'm hoping there are lots of questions. I'm going to add a recipe in the chat, one that I'll highlight, and hopefully you'll enjoy maybe for a lunch or dinner sometime this week. But we'll talk mostly first about the power of lifestyle habits, kind of that broad overview, some of which the previous speaker had talked about, which is great. And I loved hearing about all the ways that we can stay active, even while we're in this current environment where maybe we can't get to the gym as often or at all, or we're working more at a desk remotely and we're not having that accountability to move as much. So finding those ways to really build activity into your lives, but also how do we build habits around including very nutrient dense foods to improve our overall health. After that, we're going to move right into the power of plant foods, and then finally some takeaways, hopefully that you can implement today and going forward, and hopefully that you'll be able to share with your family and friends. Again, I think there's been a lot of focus recently on our health. We're in a time where we're seeing an epidemic, a pandemic, and how we define health is very personal for each individual. And I think that's the most important thing, that how we define health, how we set our own health goals, how we envision our future, and how do we build healthy longevity, I believe is really what we're all striving for. Living our life to its full potential and doing all the things that we love every single day, whatever that looks like for you as an individual. And it's not just the absence of disease. So thinking about that, how do we build habits and build lifestyles that really support our health? And we know through lots of science around behavior change, around lifestyle medicine, that these particular habits that are featured here are really at the root of health, or they're also at the root of disease. Most of our chronic diseases will find that we have lifestyle habits that are promoting that disease from even happening in the first place. So like we see featured here, the weight that we're at, that can impact the types of cancers, for example, that we may be at higher risk for, or potentially cardiovascular disease and diabetes. Same holds true with whether we smoke cigarettes or vape. Those products will put us at risk for different types of chronic diseases, and so on and so forth. With having that ability to build a nutrient dense diet being one of the main drivers of current epidemic of chronic disease. And so with today's talk, trying to give you some tips and tools that you can implement to really start to optimize your health through the foods that you eat. And this is incredibly important because we know within our own US population that the majority of us have chronic disease, and many of us have more than one chronic disease. And the reason for that being the case, especially as we stack on additional chronic diseases, is because they often have that same root cause, back to those lifestyle habits that can really drive disease. I like to think more comprehensively around disease, even when I'm seeing a patient in the emergency department, for example, is that it's not surprising that if you have cardiovascular disease, you're likely to be at higher risk also for diabetes or certain types of cancers and even cognitive decline. So as we build habits that can improve our lifestyle, that's how we can also counteract all of these different disease processes that look slightly different depending on the organ that's being affected. So in our US population, when we put out polls and we start to understand the behaviors of our US population, these are our top 4 unhealthy behaviors. And I think this would not be a surprise to anyone who's on our virtual meeting today, but these are the habits that we know are common, they drive disease. And again, if we focus on that picture of food featured there, that would be a typical meal. And we know that that way and that pattern of eating ultimately drives those common chronic diseases that we would hopefully like to prevent. And oftentimes, as I mentioned, through food as medicine, through daily exercise and finding ways to manage stress better, for example, all of those behaviors and health habits can actually then start to mitigate, and sometimes, if we're lucky enough and consistent enough, we can even reverse some diseases. But what we also know from a lot of our large population health studies is that only 5% of us do these healthy behaviors. And what are those behaviors that we find as we do these large studies? So the EPIC study was a large population study done in Europe, and they tried to understand who amongst their population were doing these 4 simple recommendations. And I say simple, but with the caveat knowing that doing this consistently every day is not easy all the time. But trying to move 30 minutes daily, avoiding tobacco use, maintaining a healthy weight, and eating a mostly plant-based diet, we can see health outcomes as we follow populations and individuals that we can then prevent and have this reduced risk for diabetes and cardiovascular disease and even certain types of cancers. And the rates by which we can reduce this risk are incredibly high. So there's power in lifestyle medicine, and there's power in the ways that we design our days that can actually improve our health over a lifetime. Follow-up study here through the American Institute for Cancer Research. And again, another large population size study that really came down to these 3 recommendations: that we could also reduce alcohol consumption. Again, we see body weight being a risk factor, and to increase plant food consumption. So again, we're starting to see patterns not only in cancer-related studies, but also in our other chronic disease-related studies that plant foods come up time and time again. When we implement these 3 recommendations, we can even see a reduced incidence of postmenopausal breast cancer. So again, there's power in these habits. As we build one habit, we can often stack on others. And over time, with consistency, again, we can see these health improvements then having an impact on different disease processes. Mary Kay had mentioned this field of lifestyle medicine, for which I'm board certified. We have another physician at Spectrum Health here who's also board certified in lifestyle medicine. And it's an emerging space in medicine where there's a profound recognition that the way that we typically practice medicine is not really getting at the root causes of disease. And it's through really using lifestyle as the treatment intervention that we can start to see dramatic changes. And I'll give you an example. We have currently a group that's going through a program that we've just recently implemented here at Spectrum Health called the Complete Health Improvement Program. And within a couple of weeks, and I'm talking 2 weeks, I've actually been actively adjusting blood pressure medications and lowering them on a couple of the patients that are involved in this program with us. And it's fantastic. These are the types of results that are within our reach, and they can happen quite quickly. And you can start to see those benefits and feel those benefits immediately when really starting to take stock of your habits and making those changes that are based in scientific evidence and also with support to make those changes sustainable. So again, focusing on these core pillars of lifestyle medicine. And now we're going to try to hone in a little bit more on that nutrition pillar since it's so incredibly important. One area or actually book that I oftentimes like to recommend or highlight because of just the amount of amazing information that we've learned from the blue zones, or these longest lived populations. So the blue zones was a project out of National Geographic where they went in search of communities around the world that had the highest proportion of centenarians, so those who lived to 100 years or more, and who were living healthy, vital lives. So most of them were not afflicted with chronic disease. They weren't taking medications, or if they were, very few. And then to try to uncover uncover what are those lifestyle habits that really supported this healthy longevity. And so here you see featured 3 of those blue zones around the world. One happens to be in the United States in Southern California and Loma Linda, where we have a high proportion of Seventh-day Adventists who naturally through their culture and religion follow very healthy habits, including exercise and a mostly plant-based diet. But if you look at the center of this diagram, I love this, the commonalities that we see amongst all of these blue zone cultures around the world. So they have great social connection through family or community. They avoid smoking. They eat a plant-based diet. There's this constant moderate physical activity. And I think that's important. If you go to the gym and enjoy doing that, that's great. But it's also how do we get in those moments of activity all throughout our day? And being intentional and building that into the way that we live our lives is going to be important because we know our current environments are really designed where we're sitting a lot, we're not moving a lot, but our bodies are meant to move. I also love one of the commonalities being legumes are included in these diets around the world. So while the taste and spices may change as you move around the globe to these different blue zone communities, beans and legumes are always included in this very plant-based or plant-forward diet. And then, getting outside, enjoying the sunshine, and a day like today, at least in West Michigan, is a great opportunity to do that. So shifting our focus a little bit to specifically nutrition and diet and how we can optimize our health through food as medicine, let's look at the state of the standard American diet or the SAD diet. So centered primarily on heavily processed foods, on animal-based products, and leaving a very small little sliver amount for those whole foods, those foods as grown that really through science, we know promote our health. So how do we get away from this lose-lose diet? And I term it that way because we lose as individuals because our health suffers as a result of eating a standard American diet. And it's also having an enormous impact on our environment. So it's just a lose overall. And let's talk about some ways and some of the science of what we know around moving to a more plant-forward way of eating that can support our health. And it's incredibly important because I've mentioned this earlier, but I like to think about chronic disease as being interrelated. So diabetes is not so different from some of our autoimmune diseases, for example. And we can see through the standard American diet, for example, or stress in our lives or environmental toxins that we're exposed to, we can have this low level of constant inflammation, this chronic inflammation that can impact the blood vessels that are feeding all of our organs. It can drive some of these inflammatory cascades that we see within our body that then can, have lots of downstream effects where, again, organs, systems. So if we're talking about cognitive decline, we see the brain being impacted by the foods that we eat or the fact that we're not moving or having that constant physical activity. So our chronic diseases are all very interrelated. And I think once we start to look at it that way, then we can start to find ways in which by improving one lifestyle habit, we're then likely to improve all of these different chronic diseases. So let's jump right into the power of plant foods. I've included this quote from Dr. T. Colin Campbell, who is the scientist that was responsible for the China study, if you're familiar with that. And this work dates back many decades now, but essentially he found himself trying to understand and uncover, looking at the entire Chinese population and finding these pockets of where there was a high degree or a high level or incidence of certain types of cancers and trying to understand what was happening within these particular communities that might have made them more at risk for certain types of cancers. And in this particular case, it was actually a type of liver cancer that they were investigating. And he found through this study that I'm showing here is that the amount of protein in the diet actually could then determine whether genes were expressed that created this type of liver cancer could be turned on or off in response to the amount of animal-based protein in a diet. So when we got to that 20% amount of protein in the diet, it actually turned on those cancer-causing genes, whereas, and this was all done in rat studies, I'll just mention that. Whereas when we had this lower protein diet, it actually could suppress or turn off those cancer-causing genes. So it was a really remarkable finding. And this was then followed up in multiple other studies that showed that we can find similar effects through some of our hormones and inflammatory proteins that we can see within our own body that can actually turn on and off these cancer-causing genes. And this is an important concept because then we start to see where our diet and lifestyle habits can actually make a significant impact, even if it seems like it's something small that we're doing. You know, if we're choosing a different meal for lunch than we normally would choose, it doesn't feel like we're doing something big. But as we make those changes and we become specific about the foods that we're including in our diet, and a lot of those plant-based foods are going to be incredibly important, we actually are having really powerful effects, not only in, you know, we talked about our blood vessels, but we're also having effects on our genome. So we have the ability, like I mentioned, and this concept of epigenetics, whether we're turning genes on or off, are incredibly impacted by our lifestyle habits. And it's through these mechanisms listed are some of the ways by which, at least at this stage, we know how those genes are responding as we make changes in our diet and lifestyle habits. All right, so let's talk specifically now. Hopefully now you're interested. Maybe you're curious about what types of food would be best to include. This is not a protocol that I'm recommending that you should only eat these foods, but I am going to highlight a few different plant-based foods that we know through the scientific and nutritional-based research can really be powerful mitigators of cancer. And if you've already been diagnosed with cancer, for example, in that survivorship phase, these may be foods that you would like to include in your diet to really enhance your health overall. So we're going to talk about flaxseed, we're going to talk about green leafy vegetables, beans and legumes. We'll talk briefly about soy as well, and then mushrooms, cruciferous vegetables, all the good stuff. So lots of, you know, plant variety that's highlighted here. So flaxseed is a really incredibly powerful way to bring in healthy plant-based fats. But not only are we getting great omega-3 fatty acids when we eat some ground flaxseed sprinkled on our oatmeal, for example, but what we're also getting are these lignin precursors. And that's important because when we eat the flaxseed, actually what happens is as it's being digested and it gets down into our gut, it's that gut microbiome, that all those healthy bacteria, which then actually kind of take this precursor and turn it into this powerful phytoestrogen, which maybe sounds like it would be a bad thing, but in fact actually has the effect to dampen the effect of our body's own estrogen. So if you think about how that might be important for certain types of breast cancers, and so flaxseed has been shown to be a really powerful dietary tool that we can implement, especially if we know that we're at high risk for breast cancer or if we're in that survivorship phase. Having 1 to 3 tablespoons of ground flaxseed in your daily diet can be a really great addition to a plant-based healthy diet. And it comes with lots of fiber and other phytonutrients, or those plant nutrients contained within that seed that our body is going to benefit from. It helps to stabilize our blood sugar. So find ways to bring in some ground flaxseed. If you purchase whole flax seeds, you would want to grind those before consuming them. Otherwise, they just kind of move through our gastrointestinal tract and we're not able to absorb all these great nutrients. But here's one way that we can enjoy flaxseed quite easily. This is something that I do pretty much every single day, whether you use steel cut oats or just regular whole rolled oats. It's a great way to bring in some flaxseed, sprinkle it on top, add your berries, maybe a little bit of a plant-based milk. I like to add walnuts to mine as well. And that's going to be a great, nutrient-dense way to start your day, a great breakfast. It's also going to help to, lower or improve your cholesterol. So finding ways to bring that flaxseed in every day. Let's switch quickly and talk about green leafy vegetables. So there's all kinds. So we have, kale and mustard greens and collard greens, romaine lettuces, all the spring mix lettuces, all types, beet greens. So if you happen to buy beets at the market, for example, keep those tops of the beets and clean them really well because they're often covered in dirt. But you can steam those, you can chop them up and use them in salad. So all these green leafy vegetables are powerhouses of nutrition. Couple of things that they're particularly great at doing when we eat them and eat them every single day is that we can prevent oxidation of LDL cholesterol. So if we think about our quote, bad cholesterol, this is a way by which we can stabilize those cholesterol particles so they become less damaging to our blood vessels. There are studies that suggest that it can reduce aging effects in the brain. So as we add in green leafy vegetables in our diet, this can be a way that we're starting to improve our blood vessels, that we're protecting our brain as we age. And then this is incredibly important too. If we think about the epigenetics that we were just speaking about briefly, is that we can help to stabilize our DNA and prevent damage to it by eating green leafy vegetables because they're high in phytonutrients, micronutrients, have an incredibly anti-inflammatory effect in our body. So finding ways to eat green leafy vegetables every single day is going to be important. If you enjoy them cooked, then lightly steamed is going to be a great option. If you like them in soups, add them at the end of making your soup. Obviously salad and grain-based dishes, you can always find ways to add in green leafy vegetables. They're going to add a really great flavor profile and visual beauty to that dish as well. Switch here to beans and legumes. As we mentioned, those blue zone populations, those longest lived populations, they include beans and legumes every single day in their diet. And why is that? This is a fantastic source of plant-based protein and fiber. They're also packed with folate and B vitamins. The other important thing that I want to highlight is this idea of the resistant starch in beans and legumes. So for example, there's some really interesting studies around what would be called the second meal effect. So if you eat some lentils like you see pictured here for lunch, you actually see your blood and insulin levels, your blood glucose and insulin levels stabilized even at the next meal. So they have this amazing effect to really modify and regulate a lot of the hormones and ways in which our metabolism works. That's very healthy for our body. And they also feed that healthy gut bacteria. And when we have a healthy gut microbiome, we actually produce what's called these short chain fatty acids. And this is an area of nutritional science that I believe is really starting to explode right now. But these short chain fatty acids have widespread effects throughout the body that can mitigate disease, help prevent disease. So feeding that healthy gut bacteria with things like beans and legumes is going to be a great thing to do every single day. And I'm going to share this recipe with you. I'll put it in the chat. This is a personal favorite of mine. My children love it. It's just a very simple recipe to throw together. Tastes great 2 or 3 days later as well. It freezes really well, but this lemon dill soup. And so we've got the green leafy vegetables in it. We've got some herbs and spices, which is always great. And then we've got that lemony flavor as well. Just a really delicious, hearty soup, especially for the upcoming fall. Couple words about soy. So we're talking about beans and legumes, so we're still in that category. Soy has been vilified in many ways, and it's actually quite a healthy thing to include in a plant-forward or plant-based diet. And especially if you're eating whole or minimally processed sources of soy. So things like tofu and tempeh, miso, which is a fermented soy, and some of the soy milks can be a great source of calcium and plant-based fats as well. You just always want to be cognizant and reading those labels to make sure that they don't have a lot of additives or added sugar. Studies suggest that it's quite safe in breast cancer, regardless of the receptor type. So it's important here to make that distinction again. It's when we're eating these whole, minimally processed sources of soy. So I'm not talking about our tofu, turkey, and things like that, that you might find these plant-based alternatives, but rather these very minimally processed ways of consuming soy can be incredibly healthy. They can actually help to improve our bone density through these phytoestrogens that are contained within soy. Let's move on to cruciferous vegetables. So if we're thinking of things like cabbage and Brussels sprouts, kale, radishes, this really beautiful family of vegetables that have a highly potent anti-cancer phytochemical. These sulforaphanes is what they're called. And they've actually been shown in some studies to have some suppression of tumor cell growth. So again, there may be an opportunity if you are someone who may be at higher risk or you're in that survivorship phase, including cruciferous vegetables, and that's also broccoli and cauliflower. They're also in that group too. Finding ways to enjoy those many times during the week. Gently steaming them, again, adding them into soups, making them, chopping them up for a raw salad, lots of different ways to enjoy these vegetables. All right, so before we close, just a couple takeaways to help you get started, but I think providing some of those recipes and ways to think about different foods to eat, I think those are the main takeaways that I would like to leave you with. But here's an example of a lifestyle medicine intervention using really food as medicine and using some of these other tools that we all have mostly within our reach. So if you're, for example, a postmenopausal patient with breast cancer, areas that we would focus on. So that high quality, whole food, plant-based diet. That's what the science suggests. That's what big organizations like the American Institute for Cancer Research are promoting, is that a plant-based diet, when designed around whole foods, so not plant-based processed foods, but whole foods, foods as grown. That's how we're going to want to design our eating patterns to really support our health. We're going to think about weight-bearing exercises so we can maintain our bone density and strong bones. And here's some great sources of calcium that you can achieve through plant-based foods. So broccoli and tofu, almonds. We didn't talk about nuts and seeds except for flaxseed, but they're going to be a great source of plant-based fats and protein. And then eating these cooked greens and beans. So that would be a strategy that we could, bring to you if you found yourself in that post-treatment phase to really enhance your health overall. And then mushrooms are going to be a great source of vitamin D, especially for those of us in Michigan and cold climates. We certainly are not going to get enough vitamin D typically through our food sources. It's that light exposure, sun exposure is what we need, but we can be intentional about including these types of foods every day to improve our vitamin D levels even. All right, so I would say, again, big take-home point, put cancer and chronic disease on a plant-based diet, and then let's add all the other great lifestyle habits that we mentioned, that we talked about, that Erin, the previous speaker, mentioned as well. Mary Kay had mentioned our lifestyle medicine practice at Spectrum Health. We are just about to open more widely in early 2021, and we're going to be focusing entirely on using lifestyle as the intervention, lifestyle as medicine. Ways that we can support groups and individuals in choosing healthy behaviors, why we should do so, and how we can actually track progress and see our diseases improving over time. We'll do these through group programs, through individualized treatment plans, and trying to stay connected with our patients on a more regular basis so we can really support you through those changes. Please reach out to me if you have questions or you're interested in learning more. My contact information is here. If you're interested in culinary medicine, which I didn't speak about specifically, but that's one of our areas within lifestyle medicine, we have been hosting classes virtually ever since COVID came to our lives back in March. So we would love to work with all of you. We have consumer classes available. You can sign up and register and join us for hands-on teaching kitchen experience in the comfort of your own home until we can get back to our in-person programming at some point. We do have a holiday-based, plant-based series coming up, so you might be interested in learning more about that because I know we all struggle around the holidays. And so with that, I will close out my slides and see if we have any questions.
Excellent, Kristi, thank you. And we have opportunity for you to be able to put some questions in the chat, if you will. And while those are populating, if I could just start, now that we've got ground flax seeds all on our shopping list, is there a place where you recommend that we buy? Is it better to go online? Is there a better product? Can we just go to Meijer and pick them up? Is there a better place to get things like flax seeds?
I would say whatever is most convenient for you, certainly. And I particularly I buy a big bag at Costco, or you could do that in bulk, I'm sure, at places like Meijer and other grocery supermarkets. If you buy a larger size bag, you're going to want to keep that in the refrigerator or the freezer so you can maintain those healthy fats and so they don't go rancid. And then what I like to do is portion out the amount that I think I'm going to use maybe over the next 2 to 4 weeks and just put it in a glass container like a mason jar. So it's quick and easy. It's right there when I open up the fridge. And that's how I store my flaxseed, is in the refrigerator.
Excellent. Yes. And can you just mention lifestyle medicine that you guys are working through the EPIC referral? So people that are working in cancer health, that they could put a referral in at some point through EPIC for lifestyle medicine. And that's brand new for EPIC as well, right?
Absolutely. Yes. So coming soon, there will be a way to refer, as you just mentioned, directly to lifestyle medicine. And that's for, to prevent, better manage, or reverse chronic disease wherever you find yourself in your health journey, so to speak. And then really finding the lifestyle habits and behaviors that you're most interested in improving at that moment of time. So we may have more options to do. It may be more beneficial to have an individual treatment plan and just stay on that treatment plan with you, or we may find some opportunities where some of our fabulous group programs that are going to be focused on food as medicine, culinary medicine topics, and then, for example, the complete health improvement program. So these are meant to be they're a bit more time intensive, but in a good way, because we really want to build these habits that we know through evidence support your health. They're going to help you see, quick and dramatic changes in how you feel. And even like I mentioned with some of the patients that were, in small groups that we're starting to work with now, pretty rapidly, we can see these improvements happening.
Yeah, excellent. You guys are just an amazing resource. Laurel is asking, could you explain the relationship with food sensitivities and inflammation? And do you recommend food sensitivity testing to promote improved health?
Well, that's a great question. And I would say a lot of the sensitivities that many of us experience are related, and I know we only touched briefly on what's happening in our gut, sort of that microbiome, those healthy bacteria that we're trying to have promote and thrive, because they help to keep us healthy and well. And a lot of our sensitivities are as a result of that dysbiosis, or having gut bacteria that's not in balance, so to speak. So one way to discover, if you choose to do sensitivity testing, I think I think there's not a great consensus as to what to do with that information once you have it available. What may even be better is to actually try to understand yourself, which are the foods that are causing you trouble, and do you feel differently? Do you feel better or worse when they're included in your diet or not? Oftentimes when we start to eliminate those highly processed foods, when we start to reduce or eliminate a lot of the animal-based foods, including dairy, we start to see food sensitivities and reactions go down. So sometimes it's just a matter of starting there, and we may start to realize some of those benefits early on, rather than starting to eliminate whole groups of foods that may otherwise provide us, immense health benefit.
Mm-hmm. Great. Another question here from, kind of populating, from Andrea, that I think this is true for a lot of folks. Does anyone on your team help people with a shopping list as a part of this to get started? If you don't eat that way, learning how to shop and prepare prepare the foods would be overwhelming. And is there a shopping list provided? And then I've always found it interesting over the years when I was putting my shopping list together. I often share with people is I always put my list together and organize my list alongside the aisles in Meijer, so that if it was the dairy aisle and it was the first aisle, that's where my shopping list started and went, to the cereal and things like that. And it just made it a lot simpler, especially if you're, a busy mom and you're working full time and trying to manage a household. It's like we look for those tips from each other that can just make life easier. So do you guys in lifestyle medicine have a way to get started and perhaps a shopping list to help folks get going?
Absolutely. Yes. And I agree. That's one of the struggles that we all are challenged with every day, is that having those healthy basics and pantry items on hand is oftentimes the first step, because then we can prevent ourselves from, going through a drive-through, or, just eating the first thing in front of us, which is often not the best choice. So planning is definitely important. If you go to the Spectrum Health Culinary Medicine website, we actually have a healthy pantry list that's available. You can print it out, take it to the supermarket with you. We also have, I think, over 100 recipes that are available to you on the site as well. And then I would also encourage you to check out some of our virtual programs that are going on now. Actually, one that started yesterday, it's called the Daily Dozen series. It goes for 6 weeks, and you get the opportunity to meet with our lifestyle medicine chef, our culinary medicine chef and dietitian, and work with them for an hour each week, and really building these habits and understanding how to cook with some of these foods that may be new to you. And none of this is about gourmet cooking. I want to be clear about that. It's about foods that are delicious on their own. They're very nutrient dense. And we also know that everybody has a busy lifestyle. So how can you start to make these changes so that they feel easy to you? Maybe not at first, but as you practice and implement these changes, especially around cooking at home. I actually put in a blog today about what are some great ways to pack a lunch, so that we're using lots of plastics and things that may leach into our food. So we have, if you're internal at Spectrum Health, we have a lifestyle medicine site called Boost Your Health. And we have, I don't even know how many posts on there that you can go and find out really helpful information on all of these pillars of lifestyle medicine, and many about food as medicine as well.
Mm-hmm. I just have to give a plug for your chili recipe that it's a pretty darn easy recipe to make, and it is good every single time. So especially with the fall here, the Lifestyle
Yes.
Medicine chili recipe is outstanding.
Awesome. I love that. It's probably a
No-
bean chili, I'm assuming.
Another question. I wonder this too. What type of probiotic supplement would you recommend, if at all? Should we be having including probiotics in our diet?
I would say it depends, but again, let's look at those prebiotic foods that we can actually eat that then feed our probiotics, which are the gut bacteria. So, some of the prebiotic foods that I would recommend, rather necessarily than taking a supplement, would be some of our fermented foods. So, I mentioned earlier, miso is a fermented soy food, or kimchi would be a fermented food that's, familiar to those of you who may enjoy Korean type dishes, sauerkraut, things like that. So those fermented foods actually have an amazing way to not only feed our healthy bacteria, but help to bring in those healthy bacteria and create colonies of those healthy bacteria. But fiber is a prebiotic and it feeds the healthy gut bacteria. So then maybe we don't need to take a supplement. There may be cases where a probiotic could be beneficial, but that would be more individualized treatment that you certainly would want to discuss with your physician and why that may be important or maybe not needed.
Yeah, another question here down another path, but I'm sure those with teenagers are interested in this. Could you provide your top 3 interventions to introduce plant-based eating to picky teenagers without having to cover it with cheese? What kind of suggestions or tips do you have to help introduce plant-based for teenagers?
Yeah, that's a great one. So I have 3 daughters of my own, 2 of whom are teenagers. So I'm with all of you out there. But I would say, consistency, modeling good behavior, you always have to start with that. I mean, if you're eating ice cream and cheese on everything, of course, that's what they're going to want to do. But there are some other great things that I know my children have learned to love and they choose this over other items. So if you're thinking about why does someone enjoy cheese, for example, it's oftentimes that creamy texture or even that salty flavor, I think is what people really are going for. You could bring in, especially if you're thinking about that creaminess, avocado would be a great thing. So we made tacos, mostly lentil tacos. We had them actually last night for dinner. And we don't put cheese out. No one in our family has cheese on their tacos. And actually, it's been a process of really, I would say, weaning my daughters even off of cheese. They never really ate very much, but we now have gotten rid of it completely because they so enjoy avocado and guac. I would say if you're on popcorn, for example, if again, that salty, cheesy flavor, nutritional yeast is something that is really delicious. You can actually put it on roast vegetables. You can put it on your freshly popped popcorn. So there are definitely tricks and tips. And again, these are the types of things that as you start to explore plant-based eating, they become more easy and second nature. Using a lot of herbs and spices are going to be another great way to, and then cooking with your children. When your child cooks it, they're more likely to try it and they're more likely to go on and eat it for a full meal. And I've hands down experienced that every single time.
Excellent. Thank you. Jessica is asking, this is such a hot topic right now. What's your take on intermittent fasting? Are there positive health benefits?
Yeah. Oh, wow. That's a whole nother talk. And actually, I've done a couple webinars on fasting. So, yes, there's definitely potential health benefits that can be achieved through rather than saying intermittent fasting. It's also like it's one of these terms that's become misunderstood, especially then when we try to take that term and look at what the science really shows. So intermittent fasting can be a lot of different things. So what I would rather talk about is time restricted eating. So if we start to restrict the number of hours within a day, when we're actually consuming food and lengthening that amount of time on the other part of the day when our body is able to rest and not have to be constantly digesting food. There's definitely health benefits that science has proven out when we do early time restricted feeding. So if we begin our eating earlier in the day and we end it earlier in the day, and I would say at least giving your body at least 12 hours of consuming no food. So you got to cut out the late night eating. I would say that's a place for most people to begin is, and something that we implement in our own home is that after dinner, the kitchen closes. Of course, you can have water and herbal teas and things like that, but otherwise, building that habit is a really important one. And then there's some other really great methods to go about a fasting protocol, and that will be something that we'll have available through our lifestyle medicine practice beginning in 2021.
Mm-hmm. And Kristi, with the variety of diets that are offered and the popularity, there's a question here from Jody about the popularity of the keto diet. Is there a correlation between a rise in cancers or in diseases with, due to inflammation because of the increased popularity of these types of diets that are more animal protein based?
Absolutely. And I would say at this point, we don't have long-term population studies on the keto diet per se, except maybe in some very specific circumstances like pediatric epilepsy, where there may be some small benefit achieved through a ketogenic diet. But these other large scientific studies, or I would say even the two studies that I highlighted today, as we look at population health over time, we always see better health outcomes over time when we eat a more plant-forward diet. So when we start to move towards something like a ketogenic diet and we start to vilify every single source of carbohydrate, which could be a bean or a legume or a whole grain, which are time and time again have been proven to be incredibly nutrient dense and protect us from chronic disease. So yes, we have enough evidence to say that the short-term benefit that you may achieve through a ketogenic diet by losing weight, which is oftentimes mostly water weight, we are actually then damaging our health over a lifetime. It doesn't mean that we can't reverse that, which we can, but we certainly see correlation. And again, like the study I showed about turning those cancer genes on and off through exposure to animal-based protein at higher level. That's essentially what we're doing with a ketogenic diet. It's a high protein, high fat diet, oftentimes primarily based on animal-based products. And then it is a driver for disease, cancer, cardiovascular disease, diabetes, cognitive decline. So yeah, it's not a good long-term health promoting strategy.
Yeah, good, thank you. And then lastly, we had mentioned this before about Headspace, and your team really drove the opportunity for Spectrum Health employees to be able to tap into Headspace. So if you had to give your top reasons, especially now during COVID, why Headspace would be so good for folks now, what would you say? Well, what would you say to encourage people to tap into Headspace?
Yeah, I think Headspace can be a nice entry into building mindfulness habits into your daily life. Whether or not, Headspace is the end all be all for you, it's a nice way to gain exposure, to start to build those habits. So I think there is quite good evidence that having a practice of mindfulness and these opportunities to, bring in gratitude and to just sort of stop for a moment and be present and aware can really can help to improve our mental health, can help to at times reduce some of that inflammation that's occurring in our bodies. So an app, if you've never been exposed to mindfulness, an app like Headspace could be a nice entry. And then if you're really curious, you may actually want to explore mindfulness a bit more and really get into some practiced and guided sessions to learn how to really practice that every single day and see those benefits over time.
Great. And then one last question, I promise, but the chat just kind of blew up there for a while. But when we talk about the animal-based diet, is it the actual protein of the animal that's of concern, or is it the part of it in the amount, or is part of it in the amount of chemicals that the animal themselves are consuming, or more vividly, probably we're instilling in animals? Is that one or the other, or both?
It's both. So independently, the animal protein, and again, I keep end up going back to this gut microbiome. There's certain amino acids that are contained within an animal-based protein that, when metabolized in our gut, actually TMAO is a sort of a new area of research in nutritional science, and understanding the link between TMAO and cardiovascular disease and cognitive decline, for example. So that is actually the animal protein itself driving the problem. And also this insulin-like growth factor 1, or IGF-1. We really see that driven up when we consume a diet with high amounts of animal-based protein, but we don't see that when we have a diet that's more focused on plant-based proteins. So one interesting tidbit that I'll mention is that there have been a couple small interesting studies around a more plant-based keto type diet, which, there's probably more nuances to that and maybe not as easy to figure out for most people. But if you're convinced that you need this low carbohydrate pattern of eating, I would encourage you to be adding in more of these plant-based proteins to protect your health over a lifetime, because we don't want you to achieve short-term benefits only to then impact your long-term health through putting yourself at higher risk for cancers, cardiovascular disease, and diabetes, for example.
Wonderful. Dr. Kristi Artz, time just flies by when we start talking, and that was clearly evident in the chat too when people started to populate with so many questions. I so appreciate your insight and your passion, and honestly, thank you for driving healthier lifestyles inside Spectrum Health and for our greater community. Definitely a pioneer in this area and helping health systems be able to step out and not only provide the traditional services, but things that keep us healthy over time. So appreciate your time today and your insights. Wonderful.
Thank you. So proud to be part of this work. And thanks everybody for tuning in today.
Excellent.
Have a great day.
Yep. Thank you, Kristi.
Thank you.
So thanks to all of you for joining us today. Tomorrow, don't forget to log in. We're going to hear from speakers about radiation complications and medical oncology treatment side effects. So those of you, and for those of you claiming CME credits, please complete the sign out from the link in the chat. And also there's instructions for evaluations in the chat. We take these evaluations seriously, and we build on the next year from the comments and the evaluation that you've given us. So we welcome your feedback. Again, thank you for tuning in today, and we hope to see you tomorrow. Bye now.